Hi, guys. Welcome to another episode of the Iraqi Nutrition Podcast. I'm your host, Juma Iraqi, and today I have with me Dr. Abbie Smith-Ryan. Abbie, how are you doing today?
I'm doing great. Thanks for having me today. Happy to be here.
Thank you so much for agreeing to do this podcast. And today we're going to talk about high intensity interval training. I know you've done a lot of research on that topic, so you would be the perfect person to talk about this. But before we dive into the questions, for people that might not know you, could you give us an introduction about yourself?
Yeah, you bet. So currently I am an assistant professor at the University of North Carolina, Chapel Hill, USA. I have been here, this is the start of my 6th year. So I've been here for a while. I did my master's and my PhD at the University of Oklahoma under Dr. Jeffrey Stout. A lot of people know me for my beta-alanine research. That's what I kind of did my master's and my dissertation on. But since having my own lab, we've got to branch out and do a number of really neat things. And one of my primary interests is high-intensity interval training.
Excellent. And have you been competing in some type of sports yourself?
I'm not competing currently, but I was a collegiate athlete, so I was a cross-country track athlete, and then did a number of triathlons, so really over the past 10 years. And then I recently had a baby, and I still exercise and train hard, but as I told Juma earlier, I enjoy my Saturday mornings too much to get up and race right now. But I still do HIIT training a couple times a week and lift heavy and do all that good stuff.
Excellent. Okay, Abbie, let's dive into the questions. And the first question is just to get off on the questions. What exactly is high intensity interval training? Because people hear a lot about it, and there's different protocols that fall into that description. So could you briefly explain the different protocols?
Sure. So there's some semantics and, what type of interval training we're talking about. But generally speaking, high intensity interval training is just a period of high intensity work followed by rest. There are a number of protocols. Kind of the foundational interval training research was actually around sprint interval training. And that's what a lot of people think of, which is really based on repeated 30-second wind gates almost. So basically all out 30-second bouts with usually like 3 to 4 minutes of recovery. Although that protocol is very effective, part of my interest that it's really hard to do on your own and really hard to do without specialized equipment because it uses a percentage of your body weight. So a lot of what I've done over the past maybe 8 years is to try and develop and test some protocols that are a little bit more feasible. Mm-hmm. One protocol we've had a lot of success with is, and there's other people that are looking at some of these protocols as well, but one that's been effective is 5 sets of 2 minutes on, 1 minute off at almost undulating intensity. So kind of starting probably around 80% and going, or 90% depends on the population, and up over 100% based on adaptations. Another one really that we've tended to lean on, especially as we move into more clinical populations, is 10 sets of 1 minute on, 1 minute off. Generally no less than 90% intensity. And that it tends to be reactive and manageable. So if you think about it, I always say you can do anything for a minute, right? So 60 seconds is not only physically manageable, but also mentally manageable. That although the 2 minute protocol is effective, and you'll see in the literature 3 minutes and 4 minutes, it's really mentally taxing to hold high intensity that long. And the 30-second protocols are great too. It's just, I would say on the reverse, and it's hard to get the intensive enough on your own without some sort of specialized equipment. So in general, and what's so great about interval training is that it can look like a lot of different things. You can switch it up really based on the premise that you're getting your heart rate up above a threshold that you couldn't maintain doing something like long, slow distance or more moderate intensity cardio. And so ultimately that, is one of the components that results in greater adaptation.
Excellent. I know this is a question that a lot of my listeners would be interested in to hear your take on it, and that is in regards to losing their gains if they use high intensity interval training. What would you say about that?
Yeah, so well, I have two comments. One, there's a good meta-analysis I can send you that really talks about concurrent training. And it, based on a sum of studies, it shows that if you're doing high intensity training, that's the best way to do concurrent training, whereas that you won't see any negative side effects, and actually you'll see a benefit both cardiovascularly and lean mass wise. And then a lot of my data specifically shows that interval training or HIIT training can increase lean mass, which is unheard of in any sort of aerobic exercise, right? And so it's actually a good strategy that we've started to use in some clinical population. Our goal is twofold. If we're trying to increase cardiovascular health, or maintain that, right? And if our goal is body composition or prevention of lean mass loss, interval training is beneficial on both levels.
Okay. Is it dependent on what type of equipment you would use? Like compared to, for example, riding a stationary bike or doing sprints? Is there a difference there?
Slightly. So I guess what we would see is more with a stationary bike, right? You're going to see more of that lean mass increase concentrated in the legs. But honestly, like the running, sprinting, you're going to see, definitely an increase in lean mass if your nutrition is on par, right? But it's, and just kind of a quick personal side note, post having a child, you don't have a lot of time to exercise. So, I've done interval training, and it's incredible amount of lean mass I put on just doing interval training, and not really intentional. I was doing it more for body composition goals. And so it's just, there's so much utility to it. And we've done it in overweight and obese where, our goal may be, obviously with some fat loss, but we see an increase in lean mass, and then also in some cancer patients where we see increases in lean mass. So it can have a variety of utility.
Okay. What type of interval training were you doing?
I prefer, personally, I prefer like treadmill and running just because, so I was a runner in college, and just based on my metabolic adaptations, the bike is good, but I don't get the same effect. Just, I think because I'm more efficient running wise. And so that's my preferred mode. I feel like I get a better intensity doing that opposed to, and you heard on HIIT, like with the cycle, I find my legs give out before my cardiovascular system.
Yeah,
but it's, individual dependent.
Yeah, exactly. So what would you say is the advantages and disadvantages to high intensity interval training compared to low intensity steady state cardio?
Well, I'll try. I guess I'll just provide the caveat that I do think there's some benefit to low intensity cardio if you enjoy it. Otherwise, the science behind interval training is just pretty hard to refute. It's just like incredible and continues to grow. And so the benefit is that it takes hardly any time, right? So if you stick with the protocol that we've been kind of evaluating most recently is the 10 sets of 1 minute on, 1 minute off, that's essentially 20 minutes. You don't really need a warm up and cool down. I mean, obviously that would be beneficial. So 20 minutes, and, we try and do it a minimum of 2 times a week, but we've done it once a week. And really, with some of the other data shows that it takes 2 weeks to see benefits. So we're talking about 4 workouts, and there's even some data looking at 1 workout. So those people that say, and we're all busy people, the people that say they don't have time to train, like this is a perfect opportunity, right? The other huge benefit of interval training is that it not only improves cardiovascular, we're seeing a lot of spillover into our ability to regulate glucose, kind of the effects on metabolism, lipids. So, really that healthy aspect, that component of lifelong health can be improved. And lastly, one of my primary interests, well, I guess there's a lot of more benefits, but one thing that is kind of what we're focusing on, is that it can be done in any population. If you look at a lot of the literature, so I'm getting some pushback now and some data we're trying to do. But look, like there's positive data in 85-year-old heart failure patients, right? Like the utility in a variety of patient populations is immense because it's all individualized and relative to your baseline fitness. So it's just the benefit over time, the effects. So kind of what I like to say is low intensity cardio is not bad, right? A lot of people do it because they think they're going to burn more fat, which is actually not really the case. The interval training, you'll actually burn more fat in less time, both during and after your exercise. And, you know, I argue that it's a little bit, it's not as hard on your body. You get overuse injuries with low intensity cardio, and just it doesn't take as long to see benefits. So if you start looking at people, you know, whether you've taken time off from training or you have people that have never exercised, sometimes it's just getting them through that initial part where you feel so terrible, right? Like if you are unfit, you don't feel good when you exercise. So interval training can kind of help you get over that hump and kind of, you know, see some of those benefits more quickly.
Excellent. And another question that people like the discussion that we often have in the fitness industry is high intensity is better, low intensity is better, etc., etc. But one thing that often comes up is the ability to recover from the type of cardio that you do when you're combining it with resistance training. So I see I see some people, like when they start to do interval training, they maybe overdo it sometimes and start with doing too much sessions of it. So what would, like, based on, obviously this would be individual to the recovery ability to each person, but the general recommendation of how many high intensity sessions you can do per week, what would that be?
Yeah, that's a great question. I think, and it goes back, and you know, I was guilty of this too, like being a person, and even the message that we're given, like, you need to do aerobic activity every day and a lot of it, right? Like, that's not the same for interval training. I think even the first time, like, it's so hard to convince yourself. Like, again, I was an endurance athlete. We put in a ton of junk miles, you know, and it's like with interval training, you finish a workout and it's really hard, but you're done. And I'm like, that's it. You know, it's like, you don't want me to be like so exhausted. I have to like pick myself up off the sidewalk. You know, you are, but it's a very different exhaustive. And so, I would always say start with about 2 times a week, and even if you're really unfit, once a week. But I would never do, I mean, even doing it 3 times a week is hard on your body, especially if you're combining it with, you know, heavy resistance training. So I would say if it's your only activity that you're doing whatsoever, I would say maybe max 4 times a week. And I know a lot of people do, and I know this is part of your interest too, but a lot of people do it for contest prep, you know, to try and reduce fat loss. And even if you do it too many times, especially during that hypocaloric intake component, I mean, it's going to be more detrimental than it is good, right? And so even minimizing it during that time, let it do its job, meaning that we know that it elevates energy expenditure for really 24 hours, around 24 hours after doing the workout. So if you think about that, if you throw in a resistance training session and another HIIT session, you're kind of spinning your wheels.
Yeah. So in regards to, you touched a bit on it, in regards to fat loss, how big is the effect on EPOC for high intensity interval training?
Yeah, pretty good. I'll speak to one study that we did, was really interesting. We compared, it was an acute study, but we compared a bout of aerobic exercise, so kind of within ACSM guidelines, a bout of high intensity resistance training and a bout of high intensity interval training. And we looked at metabolism before and up to an hour after, as well as, you know, fuel utilization or fat metabolism. And interval training just trumped both the high intensity resistance training, which was a really intense session, and aerobic training. So I think, don't quote me on this, but this is the average. It burned about 500 more calories, around that much. And then also just stimulated fat oxidation. So knowing kind of the physiological mechanism, actually like right after exercise, individuals were burning more carbohydrate because it was higher intensity, but then burned more fat basically resting during the resting phase, which is basically what you want to do. And if you looked, if we were able to differentiate, the amount of fat and carbs during exercise, you would see that would be higher with the interval training versus aerobic. So it's just one more benefit, right? You're not only burning more calories during and after, you're also able to maximize the ability to utilize fat for fuel, which is pretty important. Even more important if you're female, right? And then important if your goal is any sort of, body composition, etc.
Yeah, because that's one of the critiques that has been against high intensity interval training as well, that since the intensity is so high, you're burning more carbohydrates than you're burning fat, and people automatically think that that's going to lead to more fat loss since more fat is oxidized during the session, and they're not considering what's actually happening in all the other hours after you've finished exercising.
Yeah, and I mean, it's relative. So yeah, you're going to burn more carbohydrate, but if we compared the carbohydrate, and I don't think there's any actual data on this, but if you just think about it physiologically, because the session is shorter, you actually will not use as much glycogen storage as you would, if you go run for 45 minutes or an hour, lift goal, whatever your mode is. And so the depletion factor actually won't be as high, relatively speaking.
Okay. Another question that often gets asked is doing cardio fasted or in a fed state. So what are your recommendations when it comes to both low intensity cardio and high intensity cardio in that regards?
That's tricky. So some people are married to that fasted cardio based on the data. And there's a recent paper, I think it was 2015, a meta-analysis that really evaluated food consumption prior to exercise and looking at fat oxidation specifically. It was more pronounced in women, but both in men and women. If you're fasted, it actually reduces the amount of fat you burn. Mm-hmm. And so most people do fasted cardio because they're trying to enhance the amount of fat they're burning, right? Fat burning zone. And so essentially you're going to have to tap into muscle glycogen or protein, amino acids, which you really don't want to do either. So my take on fasted cardio is like, if you really want to do it, maybe do it once every couple of weeks, right? But if you're doing it for fat loss, you're really doing yourself a disservice. And I'll just throw in, if you're a female, you're even shooting yourself more in the foot. Like it's because we use fat for fuel as our primary fuel source, it blunts it even more. So you see that fasted cardio can really actually lead to, potential fat gain. You're just not efficiently using the stores that you're supposed to be. And so we've looked a little bit at some acute feedings and actually evaluated whether like 90 calories of carbohydrate or 90 calories of protein in women before high-intensity training is most beneficial, because most women will grab a quick carbohydrate snack or nothing at all. And the protein actually increased the amount of calories you burn during and after, and it enhanced fat oxidation. So not only is eating important, but potentially the type of food that you're eating.
Okay. And a follow-up question to that is, if you're doing 2 sessions a day, you're doing one cardio session and one resistance training session, is there any recommendation on how you should space them apart, or is it okay to do it in the same session?
Yeah, I always tell people, I mean, and if you train, this, like, you just want to do the one that's most important first, right? So if your goal is to gain, strength and resistance training is your goal, you want to do that first and sacrifice aerobic training. If your goal is cardiovascularly and, related to the aerobic training, do that first. And so as far as whether you put them together, I think that's really individual dependent and nutrition wise, right? And so if you're fit enough to do both together and you feel like you can complete them both, then do that, right? But if you're starting out and you feel like, you you can't make it through your workouts, then definitely split them up.
Okay. And if you were to split them up, is there any recommendation based on how many hours it should be between the two sessions? Is there any research
I
on
don't know.
that?
Yeah, as far as the research, the data goes, I'm not aware of anything. There could be something, but I think nutrition would be the most important component, right? To make sure that you're refueled prior to doing the next work bout.
Okay, excellent. Next question is another concern that people sometimes talk about is that when you're doing these high intensity interval training sessions in a lab setting where you sometimes have researchers screaming at you to keep the intensity really high and push you really well, do you feel that there might be a concern that the results you're actually seeing in the lab might not be converted to the real world because people are not pushing themselves as hard?
Yeah, that's a great question. So I think there may be a little bit of a concern, especially so, for example, actually completed a study where we took patients in family medicine, so just basically a primary care physician with risk factors for cardiovascular disease, and we tested them in the clinic, but then gave the program for them to do on their own at home, and tracked them, and obviously there's some limitations, but the benefit is that you don't have to be at this like gut wrenching intensity all the time. Like you're going to greater benefit that way. But if you can get your heart rate up higher than you normally would doing aerobic exercise, you're still going to see benefits. Mm-hmm. So I think if, there's some dependent upon the person. So we were doing this people with middle-aged, unfit individuals who maybe don't really understand or know what exercise should feel like. I think there'll be some limitations that maybe just won't take it. It won't be as quick as if you were in the lab to see the benefits. We're also doing a at-home interval training in pre-bone marrow transplant patients, mm-hmm. and they're actually super motivated, and so we have actually had better compliance and higher intensities with them than with like our overweight and obese because they're taking their cancer into their own hands basically. And so I think that the only thing you'll see is that maybe the changes in cardiovascular health and physiological health, they won't be quite as quick. And the magnitude maybe not quite as big, but still super beneficial. And it kind of goes back to my initial comment. Part of why we've spent some time trying to find more practical protocols. So back to that 10 sets of 1 minute on, 1 minute off. People can do that, right? Opposed to try and go all out for 30 seconds. That's kind of difficult to do.
Yeah, exactly. What about enjoyment of doing these types of exercise? Because obviously when the intensity is that high, some people might find it hard to motivate themselves to do mm-hmm. such type of training.
Yeah, so 2 levels. So just first, anecdotally, and I mean, if you've done interval training, I'm sure, I think the hardest part is getting out the door, right? And as soon as you do that first interval, it's like, okay, I feel good, right? And so in normal, healthy people, I think it's just starting, right? I get a lot of pushback from, let's say the IRB or, other researchers not into interval training. Like, how can you get people to do this? There's no way they enjoy doing it. But we had 60 overweight and obese men and women, and I think the first hump was just teaching them that exercise should hurt a little bit, that's a normal feeling, right? And then once they kind of learned that, they really enjoyed it. Like, the fact that it doesn't take as long, right? They're getting huge benefits. The enjoyment of this type of exercise is actually pretty high. And there's a couple other papers. I think there's 2 or 3 papers out on that, and some of it's our data. But people really do enjoy it.
Yeah, I think a lot of people don't mind the pain when they do resistance training, but as soon as it is cardio, people start to complain about that.
Yeah. And I think, even in the, the unfit population, I just remember when I was a college athlete, before every race, I'd say, this is going to hurt like hell. Like, you're just going to get through it, right?
Mm-hmm.
And interval training is kind of like, it's not going to be like my, like, lackadaisical run. Like, it's going to hurt, right? But it's a good hurt. And so some people that don't exercise don't really realize that it's not like no pain, no gain, right? But it's like, it should be uncomfortable. And then once you kind of teach people that, that's what keeps us coming back, right? Our adrenaline going. And so some of that is just kind of teaching how exercise should feel.
Excellent. Okay, Abbie, that was great. Thank you so much for doing this podcast with me. Where can people find more information about you?
Yeah. I'm not too much out there, but I have people can come to the department website. So here at the Department of Exercise and Sports Science at UNC, and then I'm also fairly active on Twitter, and then I can also be reached via email.
Excellent. For everybody that's watching this podcast is available on YouTube as a video, but you can also listen to it on iTunes as well. Abbie, once more, thank you so much for doing this podcast, and I wish you a pleasant day.
Yeah, thanks so much for having me. Happy to be here.
Thank you. Okay, bye-bye.
Bye-bye.